Hi there, it's me John, and here I am again giving another video tutorial, but this time I'll be talking about hematopoietic system and common disturbances. Okay, so I will begin with an introduction about your blood. I'll talk about the physiology, how blood is being formed, and I'll be talking about the different blood types as well as the RH incompatibility. Okay, I'll try to make the discussion very slow in such a way that you'll be able to catch up the topic. Okay? Now, when you say blood, blood is the only fluid connective tissue in the body. And blood constitutes 8% of your total body weight. In short, if you weigh 80 kilograms, 8% of that ay galing po sa dugo. Okay? And our blood serves three basic functions. So what are the three basic functions of your blood? Number one, the first function is that your blood plays a vital role for transportation. Transportation. The second function of your blood is, of course, protection. Protection. Third function is regulation. Okay, allow me to discuss it one by one. So when you say transportation, it is one of the primary responsibility of the blood to transport nutrients. Okay, not only nutrients, okay, it will also transport gases. Okay, so let me recap: nutrients, gases, vitamins, electrolytes, even microorganisms, even cancer cells. That is why I can still remember during my college days, my professor once told us that the blood is considered to be the river of life because of its importance to transportation. But nowadays, remember that there are a lot of diseases associated with blood. Even cancer is associated with blood, right? That is why your blood now is not just the river of life, but can also be the river of death, right? Anyway, that's your transportation. Another function of your blood is protection. Now, on what ground? The blood protects us against what? Against infection. Because there's a component in your blood that serves as soldiers in the body. Protection against bleeding, because there's a component in the blood that will protect you against blood loss, that it plays a vital role for clot formation. Okay, so this is your second function, protection. The third function of your blood is regulation of what? Regulation of temperature, because there's a specific temperature for that, right? In the blood has a specific temperature. Now, our blood has two basic components. So what are the two basic components of your blood? Here, components. Okay, first, second. First is what we call your plasma. Okay, the second component of your blood, we call this as your formed elements. Okay, reminder, your plasma is the most abundant component of your blood. Your plasma is about 55% of your total blood volume. It is about 55%. And formed elements, it is about 45% of your total blood volume. Now, when I say plasma, okay, if you were able to view or check the previous video clips I made, it has something to do with fluids and electrolytes. The first part of fluids and electrolytes wherein I mentioned plasma, right? The plasma is the fluid inside the blood vessel, right? This is actually the liquid part of the blood. Okay, this is the liquid part of the blood, and we call this a intravascular fluid, the fluid inside the blood vessel. Now, since it is liquid part of the blood, plasma is primarily made up of water. Big portion of your plasma is water. Okay, your plasma also contains, of course, waste products. Your plasma also contains nutrients. Your plasma even contains electrolytes. Your plasma contains protein. Now, I need to stress this one. There are two primary or abundant proteins that can be found in your plasma. First is what we call your albumin. Familiar albumin? I hope so. Remember, albumin is a protein that maintains oncotic pressure. Okay? Another protein that can be found in the plasma is what we call your immunoglobulins. Another name for immunoglobulin is what we call your antibodies. Now, remember, plasma contains antibodies. Now, there is a condition that is said to be autoimmune, right? One good example of an autoimmune problem is your multiple sclerosis. Another example is what we call your Guillain-Barré syndrome. Another example of an autoimmune is your myasthenia gravis or myasthenia gravis. These three conditions are autoimmune. And autoimmunes are conditions wherein the immune system attacks your own body structure. Having said that it is something to do with the immune system and antibodies has something to do with that autoimmune, one management for autoimmune problem, just like your MS, just like your MG, just like your GBS, is to clean the plasma of the patient. You call the procedure as your plasmapheresis. Therefore, the primary reason why doctors recommend plasmapheresis is to decrease circulating antibodies, because these antibodies are the main reasons why autoimmune happens. Now, what specific antibody here? Common is your immunoglobulin G or IgG. Okay, next. Another thing that can be found in your plasma, okay, are the clotting factors. Clotting factors. There you go again. Dogs are barking. Don't mind that, okay? Clotting factors. If you can still remember, clotting factors are so important to control prevent bleeding. Any deficiency in the clotting factor will increase the risk of bleeding tendencies. And one condition wherein characterized by a deficiency in clotting factor is what we call hemophilia. Having said that clotting factor can be seen in the plasma, that is why one management for hemophilia is cryoprecipitate. Cryo is you freeze the blood and you get the precipitate. You get the plasma. Can you follow? And you transfuse plasma to your patient in cryoprecipitate. Why do we transfuse plasma to patient with hemophilia? Because in hemophilia, there is lacking clotting factor. And clotting factor can be found in the plasma. That is why we give plasma to your patient. Just be very cautious when you give plasma to your patient, because one complication of plasma transfusion is, of course, one is hypervolemia. Second, it can cause yellow discoloration of the skin. The yellow discoloration of the skin is not brought about by liver problem, not brought about by gallbladder problem. The yellow discoloration is secondary to pooling of plasma in the body. That is why in cryoprecipitate, you watch out for yellow discoloration of the skin and at the same time, hypervolemia. Next, another component of your blood, as mentioned, will be your formed elements. Formed elements. Now, when I say formed elements, there are three major formed elements. And what are these three formed elements? You have the RBC. You call this as your erythrocytes. These are cells that will carry oxygen and carbon dioxide, right? Now, the normal RBC count ranges from, of course, you know this one, 4.8 to 5.4 millions per cubic millimeter. O, di ba, taray? Buti pa yung dugo may milyon. O, di ba? Sana convertible to cash. Kasi kung convertible to cash, ang tagal na nating nagpa-in cash. Okay? That's your RBC. Next. Another is your WBC. You also call this as your leukocytes. Right? Now, the RBCs, as mentioned a while ago, nasabi ko, it is something to do with protection, right? So it is your did I say RBC? I'm talking about WBC. Let's go back. Okay, remember I mentioned a while ago protection, right? So this is the thing I'm talking about. This is the cell in the blood that serves as soldiers in the body. They will protect you in any form of assault, okay? Particularly infection, invasion of microorganisms, okay? So the normal WBC count ranges from, of course, 5,000 to 10,000 per cubic millimeter. Okay, that's your 5,000 to 10,000 per cubic millimeter. And another formed element is what we call your platelet. Am I right? We also call platelet as your thrombocytes. Okay? This is actually a cell that initially control or prevent bleeding. But the effect of your platelet is only temporary. Can you follow? What gives a permanent effect is your clotting factor. Okay? Anyway, the normal platelet count ranges from 150,000 to 450,000 per cubic millimeter. It is 150,000 to 450,000 per cubic millimeter. I know in your mind you may have other normal values. It's okay. You might be using other textbook. Okay? So but anyway, this is my normal value. If you have other value, it's fine with me. Okay? So these are what we call formed elements. The question, saan ba na-form yung blood? Am I right? So where is this what we call hematopoiesis occurs? Hematopoiesis or blood formation, of course, it happens inside the bone marrow, particularly the red bone marrow. By the way, the site of red bone marrow differs sa age. Depende sa edad ng pasyente. The red bone marrow for pediatrics, sa mga bata, the red bone marrow for pediatrics can be found in the long bone. But the red bone marrow for adult can be found sa flat bone. That is why if your patient is scheduled for bone marrow aspiration biopsy, you should know the age of the patient. Can you follow? Because if it's pediatric, the site will be long bone. If it is an adult, the site will be flat bone. Usually for adult, the site is on the iliac crest. Okay? For your bone marrow aspiration. Anyway, okay, I mentioned that blood formation happens inside the red bone marrow. So look, if this is the red bone marrow, inside the red bone marrow, there is a cell. Okay? Okay, this cell is what we call pluripotent. Pluripotent stem cell. Okay, sir, what is pluripotent? Is that the same with impotent? No. Is that the same with omnipotent? No. So what is pluripotent? When you say pluripotent, it means to say that from a single cell, okay, it has the ability to divide, multiply, proliferate into different or several types of cells from a single cell. Can you follow? So that is what we call pluripotent. So from a single pluripotent stem cell, it will give birth to two different stem cells. First, you call that a myeloid. Second, we call this a lymphoid. Can you follow? This myeloid stem cell will produce, okay, three important cells. Okay, it becomes RBC, WBC, and of course, your platelet. Whereas your lymphoid will only produce two daughter cells. This will be your B lymphocyte or B cell, T lymphocyte or T cells. So please be reminded, RBC, WBC, platelet, these cells originate from myeloid. B cells, T cells, they originate from lymphoid. Remember, there is what we call cancer of the blood, and we call that as leukemia. Leukemia is divided into two, myeloid and lymphoid type. So that is why if you will encounter acute myelogenous leukemia, chronic myelogenous leukemia, it has something to do with the myeloid. If you will encounter acute lymphocytic leukemia, chronic lymphocytic leukemia, it has something to do with the lymphoid. Can you follow? I believe I mentioned the importance of RBC, WBC, and platelet kanina. So let's focus here in your B lymphocytes and your T lymphocytes. Let's start with your B lymphocytes. Your B lymphocytes, okay, will transform into what we call plasma. Ayan na naman yung toko, my best friend. Oh, go lang. Yes. Yes, one more. Ay, nahiya. Anyway, your B lymphocytes will transform into plasma cells. Please be reminded that B lymphocytes must only be present inside the bone marrow. There should be no B lymphocytes circulating in the systemic circulation. Presence of B lymphocytes in the systemic circulation is an indication of what we call myeloma. Can you follow? So B lymphocytes must only be present inside the bone marrow. Presence of B lymphocytes outside is what we call myeloma. Can you follow? Now let's proceed. Hold on. I just drink water, okay? Ouch. Okay, let's go back. Okay, again. The lymphoid stem cell will produce two daughter cells, the B lymphocytes and T lymphocytes, okay? The B lymphocytes will transform into plasma cells, and I mentioned B cells or B lymphocytes must only be present inside the bone marrow. Presence of B lymphocytes in the systemic circulation indicates multiple myeloma, okay? Now, your plasma cells are cells responsible in producing what we call antibodies. Another name for antibodies, you call this a short immunoglobulins. I hope you can still remember immunoglobulins. There are actually 5 major immunoglobulins or antibodies. Now what are this? You have your gamete. Can you still remember? I hope so. So these are your 5 antibodies or 5 immunoglobulins. Your immunoglobulin G is the most abundant immunoglobulin. Okay? So this is the most abundant. And mind you, immunoglobulin G is the only immunoglobulin that can pass the placenta. Okay? It can pass the placenta. And another thing, immunoglobulin G is the immunoglobulin that serves as a precursor for demyelination. Remember demyelination? Destruction of your myelin sheath. If demyelination happens in the CNS, you call that as multiple sclerosis. If demyelination happens in the PNS, you call that as Guillain-Barré syndrome. So these two are what we call demyelinative disorders, and demyelination or destruction of the myelin sheath is actually brought about by immunoglobulin G. That is why if you have CSF analysis, and if in your CSF analysis electrophoresis of the CSF reveals an elevated IgG in the CSF of the patient, that would mean demyelination. Okay? So this is the thing that causes destruction of the myelin sheath, your immunoglobulin G. Next, immunoglobulin A. Immunoglobulin A is a type of immunoglobulin that can be found common where? In the body fluid. Very common is where? Breast milk of the patient. Okay? Remember? The first breast milk, okay, that contains a lot of antibodies. You call that a short colostrum. Can you follow? By the way, breast milk contains rich in immunoglobulin A. What type of immunity is this? Active or passive immunity? Remember, when you say passive immunity, you give antibody. You give immunoglobulin. So pag breast milk yan, binigay mo sa bata. Therefore, it's passive immunity. Can you follow? So this is what we call natural passive immunity. Okay? Anyway, let's go back. Immunoglobulin M or IgM is a type of antibody or immunoglobulin, okay, common when? During bacterial infections. Immunoglobulin E is present during allergic reactions. Just like your asthma. Kaya nga another name for asthma, kailangan pag allergic asthma, we call this as your immunoglobulin E-mediated asthma attack. Can you follow? And of course, D, it has an unknown, okay, contribution. So these are the different antibodies or immunoglobulins. Okay? Let's not forget this. Now, what about your T lymphocytes or your T cells? Reminder, your T lymphocytes or T cells produced with the bone marrow are actually useless. Walang silbihan. Magiging useful lang siya if the T lymphocytes, okay, will go to your thymus. Can you follow? Now, where is your thymus situated? Your thymus is situated at the back of the sternum fronting the heart. Dito banda yung thymus. Remember, when you were still young, malaki yung thymus. But when you grow old, the thymus now will atrophy. Lumiliit siya. Okay? Now, what is the importance of your thymus? Remember that your thymus, as a form of a gland, it produces a hormone, a substance called thymosin. This thymosin is important for differentiation and proliferation of your T lymphocytes. Na kung saan, kung pupunta ang T lymphocytes sa thymus, the T lymphocytes now will proliferate and differentiate into a more useful T cell. Can you follow? So magiging ano siya? Okay, magiging helper T cell. Am I right? Magiging ano pa? Magiging killer cell. Magiging memory cell. Magiging suppressor T cell. Can you follow? So it will transform into a more useful T lymphocyte. Na, reminder, hindi lalabas ang other cells pag walang helper T cell. Another thing, helper T cell is the cell target of your HIV infection. Reminder, another name of helper T cell is your CD4 cell. Remember, if your CD4 count is less than 200, plus you manifest opportunistic infection, you are now labeled as AIDS category. Remember AIDS? Acquired immune deficiency syndrome. So if your CD4 is more than 200, at wala kang opportunistic infection, you are just an HIV infected person. But if your CD4 is less than 200 And there are what we call opportunistic infections. Your HIV infection progresses to AIDS category. We're in AIDS stands for acquired immune deficiency syndrome. Can you follow? So anyway, the lymphocyte and the lymphoid rather and the myeloid. So this is how the blood being transformed. Can you follow? Inside the bone marrow. Can you follow? The question here, what about the different blood types? Allow me to erase the board. Okay? Now, we have actually 3 blood types, right? The 3 blood types. You have your blood type A, blood type B, and blood type O. And of course, pag nakumbine yung A and B, we call that type AB. Can you follow? So you have your blood type A, blood type B, blood type O, and blood type AB. The question here is that if your patient is blood type A, what type of blood can be given to your patient? Anong dugo ang pwedeng maisalin pag yung pasyente mo ay type A? Okay, take note ha. Anong dugo ang pwedeng maisalin pag ang pasyente mo ay type A? Answer. If the patient is blood type A, ang dugo na pwedeng maibigay sa pasyente is A or O. A or O lang. If the blood type of the patient is type B, ang dugo na pwedeng maibigay sa pasyente will be type B or type O. If the blood type of the patient is O, you can only give type O blood. Hindi pwede magbigay ng ibang klaseng dugo. If the blood type of the patient is AB, you can give AB, you can give A, you can give B, you can give O. In short, if the blood type of the patient is AB, lahat na dugo pwede mong ibigay sa kanya. May it be type A, type B, type O, type AB. Question, based on this distribution, okay, anong dugo ang pwedeng tumanggap ng kahit anong klaseng dugo? Anong dugo ang pwedeng mag-donate kahit saan kaninong pasyente? So the question here, what will be the universal blood donor and the universal blood recipient? Remember, pag donor, nagbibigay. So, anong dugo ang pwedeng mag-donate sa kahit anong klaseng dugo? Answer, type O. Remember, type O can donate to any type of blood. Type O. Anong dugo ang pwedeng tumanggap ng kahit anong klaseng dugo? It's your AB. Remember, technique. Pag donor, nagbibigay. Pag recipient, tumatanggap. O, pag Bisaya ka, dapat alam mo to. Pag donor, nagbibigay. Technique, nagbibigay. O. Type O. Pag recipient, tumatanggap. Bisaya, tumatanggap. Ambi. It's AB. Can you follow? Now, highlight in your examination. Kasi minsan tinatanong, if the blood type of the patient is type A type A blood contains what type of antigen? Contains what type of antibody? So, ganito yon. Erase ko muna. Here, if the blood type of the patient is type A, it contains antigen A. If the, If the blood type of the patient is type B, it contains antigen B. If the blood type of the patient is type O, it does not contain any antigen. If the blood type of the patient is AB, it contains antigen A and antigen B. Can you follow? If the blood type of the patient is type A, it contains antibody B. If the blood type of the patient is type B, it contains antibody A. If the blood type of the patient is type O, it contains antibody A and B. If the blood type of the patient is type AB, it does not contain any antibody. Kaya nga, kung ang AB walang antibody, you can give any type of blood. Can you follow? Kung ang O walang antigen, it can give to any type of blood. Can you follow? It can donate to any patient with any type of blood because O is the universal blood donor. Can you follow? Now, with respect to what we call RH, positive and RH negative, kasi marami pa rin nalilito sa RH. RH stands for rhesus. Am I right? Remember the rhesus monkey? Okay, during the test before. Now, RH positive blood means that that blood contains RH antigen. RH negative blood is a blood without RH antigen. Okay, remember, I mentioned antigen. What is an antigen? Antigen is anything. It could be a protein. Can you follow? It could be a microorganism. It is anything, a protein, a substance, a microorganism that can trigger immune system to produce antibodies. Can you follow? An antibody is a protein produced by the immune system in response to antigen. So kung may antigen, may immune reaction, may immune stimulation. Can you follow? So therefore, dito lumalabas yung RH incompatibility. Your RH incompatibility is divided into two concepts, no? RH incompatibility under OB concept and RH incompatibility with your medical surgical nursing. So here it is. This is OB, this is your med surg. Now reminder, RH incompatibility is common to RH negative individuals. Take note ha, RH incompatibility is common to RH negative. Ibig sabihin, their blood does not contain RH antigen. Okay, reminder, OB concept muna tayo. So this is the mom. Ayan, buntis yung mom. Please bear with my drawing. Okay, reminder, ang mama, RH negative. Ibig sabihin, the blood of the pregnant mom does not contain RH antigen. Walang antigen. This is the placenta. Okay? This is the baby. The umbilical cord. The blood of the baby is RH positive. So again, here's the scenario. Ang dugo ng mama, walang antigen, RH negative. Ang dugo ng bata may antigen na RH antigen kaya RH positive. Remember, the baby will stay inside the uterus for about 10 lunar months or 9 months. Am I right? After a specific period of time, the baby will be expelled out from the uterus. That is why during delivery, remember, the only link between maternal and fetal is the placenta. Am I right? There is a chance that during delivery, paglabas ng bata, the fetal blood that contains RH antigen will leak and enter the maternal circulation. In short, during delivery, may posibilidad na yung dugo ng bata na may antigen makapasok sa loob ng dugo ng mama na walang antigen. Even only 1 to 2 drops of blood of the baby, it can trigger immune reaction. Anong mangyayari? Remember, yung dugo ng bata may antigen. Ang dugo ng mama walang antigen. Therefore, pag yung dugo ng bata nakapasok sa dugo ng mama na walang antigen, pag nakapasok sa loob ng katawan ng mama, it will stimulate the immune system of the mother to produce immunoglobulins or antibodies. Sabi ko, pag may antigen, may immune reaction, triggering immune system to produce antibodies. Papatayin ng antibodies ang antigen. Ang problema, nakalabas na yung bata. Can you follow? Nakalabas yung bata. Therefore, hindi affected ang first pregnancy, ang first delivery. Can you follow? But, following year, nabuntis again yung mama. Can you follow? Nabuntis again siya. Nung pagkabuntis niya, second pregnancy, yung bata is RH positive. Remember, this is the second pregnancy now. I mentioned hindi affected ang first pregnancy. Succeeding pregnancy, let's say, yung bata is RH positive. yung na-form na immunoglobulin or antibodies dati sa first pregnancy, kasi na-stimulate ang immune system, ma-activate. Pupunta inside, okay, sisirain ang RBC ng bata. Sir, why will antibodies destroy RBC? Because Rh antigen can be found in the RBC. Kaya pag nasira ang dugo ng bata, mamamatay yung bata. Mahuhulugan. Magkakaroon ka ng tinatawag na abortion. Kaya nga, pag ang babae ay Rh negative, common ang Rh incompatibility. Therefore, what is your priority action as a nurse? On the first 72 hours after delivery, within 72 hours within 72 hours after delivery, there is a need for you to give ROGAM. Sir, why do you have to give ROGAM to Rh negative pregnant within 72 hours after delivery? The purpose of your ROGAM is to prevent immune system to produce antibodies. Kaya ibig sabihin, Rh incompatibility will not affect the first pregnancy, but succeeding pregnancies na ang bata Rh positive. Can you follow? So this is the concept in your OB nursing. What about the concept in your med-surg? Ito yon. Our patient is Rh negative. Okay? The patient had an accident and the patient nawala ng maraming dugo and the patient requires massive and immediate blood transfusion. Ang tanong, if the patient is Rh negative, can we transfuse Rh positive blood? Answer, no. Am I right? If the patient blood is Rh negative, can we give Rh negative blood? Answer, yes, that's ideal. Sir, kung Rh negative yung patient, dapat ang ibibigay na dugo Rh negative din. Correct. Hindi talaga pwede magbigay ng Rh positive. Actually, pwede. But here's the rule. You can give Rh positive blood to an Rh negative patient provided that that is his first time to receive Rh positive blood. Succeeding transfusions after that must be Rh negative. Can you follow? So why? If the patient is Rh negative, ideally Rh negative blood ang ibibigay. But in emergency cases na wala kang makita, you may give Rh positive provided that is his first time to receive the Rh positive blood. Because, ayan na naman, tama na. Ayan. Look, pwede ka magbigay ng Rh positive blood provided that that is his first time. Look, when that Rh positive blood enters the bloodstream of the patient, remember it contains antigen. Ang dugo ng pasyente walang antigen. So pagpasok ng blood na may antigen, it stimulates now the immune system of the person to produce antibodies or immunoglobulins. That is why succeeding transfusion must be Rh negative. The moment you give Rh positive blood the second time around, yung antibodies na form during his or her first transfusion of Rh positive blood will be activated and it will destroy its own RBC. The patient will die. Can you follow? So the rule, if the patient is Rh negative, you give Rh negative blood only. Can you follow? But in some cases, I said in emergency, we can give Rh positive provided that that is his first time to receive Rh positive. Succeeding transfusions throughout his life must be Rh negative. So the question here is that, what about the ABO and the Rh compatibility? So how are you going to, what type of blood will you give if the patient is A positive, A negative? Ito po yun. Okay? Blood type. A positive, A negative, B positive, B negative, O positive, O negative, AB positive, AB negative. Alright? Remember your A, B, O, and AB. Here, okay? So these are the blood types of the patient, and I'm going to write here the blood that can be given to patient with this type of blood, or a blood that can be transfused to this type of blood. Now remember, if the blood type of the patient is type A positive, what blood can you give to that patient? You can give A positive, you can give A negative, you can give O positive or O negative. Can you follow? Remember, pag positive, may antigen. So kung may antigen, you don't have to worry. You can give a blood with antigen or a blood without antigen. Kasi siya mismo may antigen. Remember, I said, RH incompatibility is only common to RH negative blood. So wala kang problema pag positive. Ang problema mo lang pag ang blood is negative mismo. Yung tatanggap ng dugo. If the blood type of the patient is O negative, what blood can be given to that patient? You can give A negative and O negative only. Can you follow? You cannot give A positive. You cannot give O positive. Now, if the blood type of the patient is B positive, what blood can be given? B positive, B negative, O positive, O negative. If the blood type of the patient is B negative, you can only give B negative blood or O negative blood. If the blood type of the patient is O positive, you can give O positive blood or O negative blood. If the blood type of the patient is O negative, you can only give O negative blood. If the blood type of the patient is AB positive, what blood can be given? AB positive, AB negative, A positive, A negative, B positive, B negative, O positive, O negative. Can you follow? But if the blood type of the patient is AB negative, you can only give AB negative blood, A negative blood, B negative blood, O negative blood. Can you follow? Now, question in your exam. What if you don't know the blood type of the patient? What do you think is the safest blood? You try to analyze what type of blood can be given to any type of blood. Sabi natin, universal blood donor is O. Am I right? If you notice, O can be given to any type of blood. But the question here, is it O positive or O negative? Answer, O negative. Remember, O negative, negative, negative can be given to any type of blood. That is why the safest blood is O negative, not O positive. Can you follow? Why O? Because O is the universal blood donor. Why negative? Because it does not contain antigen. No RH antigen, no immune reaction. Can you follow? So that is what we call blood. I hope you learned something of this discussion. Thank you so much and God bless.